Hi, Dr. House MD is one of the most analytical and exciting TV series on medicine, and there is no more exciting than seizure scenes. However, those scenes are full of sometimes not so accurate information and practices. Let's review them all today. All those dramatic scenes when the seizure happens.
C
She's not able to talk.
A L H E stop. We know that word stop.
Oh my God. Kids are freaking out. So this was a pretty good seizure scene. At the beginning, she was not able to talk, which might be in the left side of the brain. She was writing in her right hand, so she's right-handed. That means her language is in the left side of the brain. So when the seizure happens in the left side of the brain, the patient will not be able to communicate. So they'll be having pausing in the talk and will not be able to speak. And that is called focal impaired awareness seizures if they lose awareness of their surroundings. However, mostly the patient, if they're not able to talk, they might not able to be writing as well. The baby.
Hey, you seizure, get your credit card. Some help in there.
Oh God, is she all right?
Call for help. That's a pretty good seizure scene. It happens in little baby. The first thing they did was to call for help, which is the right thing to do. Call for help so that other people will come and help you. Definitely not that dramatic when it happens in children. Yes, you want to put the child in a safe place. And then it's better if they turn the child on the side so that any mucus comes out of the mouth if the child will to throw up or have something. And then in seizures that last for longer than 5 minutes, not every seizure. If the seizure lasts for longer than 5 minutes, we give rescue treatment, which in the hospital we can give lorazepam or Ativan, and then midazolam and diazepam. Those are rescue treatments that we can give to the patient to stop the seizure that's going.
He's coming for me. He's burning.
Some kind of visual hallucination.
Let's get her on some Ativan. Smells religious visions, symptomatic temporal lobe swelling. We don't want to.
Oh, she's seizing.
Can we get her on our side?
At the beginning, when the seizure happens, she was seeing faces, and he said that's a religious aura. That this is called aura, means at the beginning of the seizure, the breeze, and this can be, if it starts in the temporal lobe, it can start with vision and feelings, and sometimes, like he said, religious ones, and that is accurate. And then the seizure moves from that area in the temporal lobe to the motor cortex, and once it reaches the motor cortex where the movement happens, then the patient will have shaking. But it's not like that aggressive shaking and that fast transition, but you know, this can happen, and they put her on the side, which is a good treatment. Let's see what happens.
Religious visions? And next comes
Some evidence here. Oh! Do not do that. This is a major mistake. So he's trying to put something in her mouth, a cloth or a tongue depressor. This is a major mistake in the first aid of seizures, and never do that. We should never put anything in the patient's mouth. The patient might bite their tongue, yes, because of the tensing of all the muscles of mastications, like tensing up. However, if you put anything in the mouth, to try to open the mouth, that will only exacerbate the injury. They can break their teeth if it's a hard object, so never put anything in the mouth. Once the seizure stops, then that will loosen up as well. So never put anything in the patient's mouth, because that will cause more injuries. And this is dangerous because like they are showing those as an example of first aid of seizures, and it has consequences. Look at this guy.
Come on. I got it.
She started having a seizure, or?
She started having a seizure. I don't know if she hit a car, but she then went into the guardrail here.
Anyone here like medically trained at all or know what to do?
Basically, you gotta tilt, you gotta keep her head sideways. We have to get a pin or something else to keep her tongue out of her throat.
You hear that? He's so this guy was vlogging on a motorcycle, and then he had a car accident, and he witnessed that, and then the first thing he said, let's get something for her mouth, and that is something dangerous to do, and you know, see, those shows have long-term consequences and changes in the people's perception of seizures and the first aid. So this is a wrong practice.
Honey, you're right.
He's seizing. The other side. I need the man. Okay.
Again. So this is a seizure that the patient was shaking. This tend to be very aggressive and very fast transition between not moving and shaking all over. Usually seizure starts as a aura or one area sensation, then it will tense up, and then after that we'll have some clonic shaking, not like this, like back and forth. Usually it's arms and legs, clonic shaking, they call tonic and then clonic, and not that fast, but they're acting. So what he also did is that he put something in her mouth. Let's see that.
What's happened?
Seizure.
She's aspirating.
So here what he did is wrong. He is trying to put something in her mouth, which is wrong. So one comment that no patient will swallow their tongue, because this is impossible to happen physiologically and anatomically. No one can swallow their tongue. So it is a myth in epilepsy, and it is a misinformation that's not correct. No one can swallow their tongue, and don't put anything in her mouth. You turn her to the side, to the patient to the side, and then help them by, if there is any secretions, it will come out of the mouth, and then you can help with the suction from outside, and don't put the suction inside the mouth or in the teeth.
Come on, Elise.
He's even inducing gag by this suction in her mouth.
Has he ever had any problems like this before? Any family history?
No. Just me and her.
Guys, 10 milligrams, stop.
Right, what's going on?
Take some precautions.
Seizing. Cool, man. Calm down.
So this seizure started with shaking in the arm and face, and this is more realistic one, because usually seizure starts in one area of the brain, like maybe like in her is the left side of the brain, start having seizures in the motor cortex where the movements will start in the face and arm, and then it moved on to other areas of the brain and then other areas of the body. And so that's pretty cool explanation and demonstration of a seizure. And this phenomena was described by Dr. Helen Jackson a long time ago, and this is called Jacksonian march. It moves from one area to another, and that's how seizures usually do. And then you want to be chill and cool like Dr. House here. He's just standing up there and not doing anything, and this is like a good response, but you also have to help the patient. So he ordered stat diazepam, which is a rescue treatment, which is good.
She's seizing.
Give me some Ativan.
She doesn't want to be discharged. She's manipulating me.
This is bad. So he said that there is an intent behind it, so that she's manipulating. She doesn't want to get discharged, so she's faking a seizure. That's what he is intending by saying manipulating. So what the other doctor is testing her is that he put her arm up and then let go of the arm, and then the arm hit her face, and then he said, "Doc, no, it's real." So this is not accurate actually, because in patients who have epileptic seizures, they do not have control of their body, and then they will be shaking all over. Mostly they will be tense. If you put their arm, they will stay there. And even if they fall, yeah, they can hit their face. And patients who have non-epileptic seizures, means that seizure from a psychological cause, they also can hit their face. There is a misinformation that people who are having non-epileptic seizures, they will kind of avoid hitting their face when you drop it, and that is not accurate. Patients who have non-epileptic seizures, they have complete dissociation between the brain and the mind, and usually they do hit themselves, and that's not an accurate, and don't do that, and don't pinch them and inflict pain to prove that they're not having an epileptic seizure. In very, 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 very rare cases of malingering, means faking the seizure, which does not happen in psychological seizures, yes, those tests might help, but I would not recommend doing it for patients. So let's see what was the reason why this seizure happened.
It's real. Check a finger stick.
So finger stick, that's a good evaluation right away for glucose.
Blood sugar is 38.
The blood sugar was 38.
For stat.
Her blood sugar was 38, which is the cause of her seizures. So hypoglycemia, low blood sugar, can induce seizures, and this is called provoked seizures. And those are not considered epilepsy, like any provoked seizure from drugs, from withdrawal of alcohol, withdrawal of benzodiazepines. Those are all provoked seizures, do not fit the criteria for epilepsy. And to learn about like all the different types of seizures and epilepsy and how the seizures look like, so you'll be able to spot them right away, you can see this video about all types of seizures, and stay healthy and see you in the next one. Salam.